जी ओके मैम.
This is brain. This is cerebral cortex. Here is the cerebellum. This one is midbrain. Here is pons. This one is medulla oblongata. Today we will study cerebellum. Cerebellum is cauliflower-like structure situated on posterior aspect just below the occipital lobe of the cerebrum. In between these two, there is one dural fold known as tentorium cerebelli. Okay, so this one is the anterior aspect and here is the posterior aspect. So cerebellum lies posterior to the fourth ventricle. Here lies a cavity that is known as fourth ventricle. Anteriorly there is pons and medulla oblongata, and posteriorly there are two cerebellar hemisphere. This cerebellum, like cerebral cortex, also made up of two half, which is known as cerebellar hemisphere. Okay. So this is the anterior aspect of the cerebellum here. This is the two anterior aspect of the cerebellum which form the roof of the fourth ventricle, and this one is the posterior aspect of cerebellum. These two cerebellar hemispheres are connected by these are two cerebellum. These are connected by vermis. Likewise, cerebral cortex are connected by corpus callosum. This is the commissural fiber in between. Likewise, two cerebellar hemispheres are connected by vermis. This is superior vermis. This is the superior aspect of the cerebellum. So here lies the superior vermis, and this one is the inferior vermis because it lies inferiorly. So superior vermis, it is on the surface, we can touch it, but inferior vermis is lie within the valley, which is known as within a depression that is known as vallecula. We can't touch it. It is deep within inferior vermis, but superior vermis we can touch it. Okay, and this is the dissected part of the cerebellum. So this one is superior vermis and this is inferior vermis, which is lies within the vallecula. Okay, now the vermis, it has got whole of this cerebellar hemisphere has got vermis and cerebellar cortex. And vermis, there are, first we will discuss about the fissure. This is primary fissura. Here we can see this one is the primary fissura. This one is the horizontal fissure. Here this one is the horizontal fissure, and here lies the posterolateral fissure. We can appreciate it. Here is the primary fissure. This one, this fissure where my finger is, this is the fissura prima. Okay, and this fissure, this one fissure, this is horizontal fissure. This fissure is known as horizontal fissure, and here there is one also fissure. This is known as posterolateral fissure. It is on the posterior aspect and laterally somewhat. So posterolateral fissure, this one, and this is horizontal fissure, and this is fissura prima. Here lies the fissura prima here. Okay, and this is our vermis, superior vermis, inferior vermis, and here is the cerebellar cortex. Cerebellum has got three lobes. Anterior lobe, which lies in front of the fissura prima, only this much. Okay, the vermis and the cerebellar cortex from here. This one is the both side anterior lobe. Then in between the fissura prima and this is the posterolateral sulcus. Okay, in between these two, here lies the posterior lobe. It is on the superior aspect as well as on the inferior aspect, both sides. And here is the flocculonodular lobe. Only this much is the flocculonodular lobe. Okay. In the vermis, there is LCC. In the anterior lobe, LCC, lingula then central lobule, and then culmen. And cerebellar cortex, there is LCC and AA, that is ala and anterior quadrangular lobule. This is about the anterior lobe. Now coming to posterior lobe, in the middle, the part of the worm is LCC and then declive, folium, declive, folium, tubercle, pyramid, uvula. This much is the part of the vermis comes under the posterior lobe. Okay? And cerebellar cortex, which comes under the posterior lobe, are posterior quadrangular lobule, superior semilunar lobule, inferior semilunar lobule, biventral lobule. Okay? And two tonsils. Okay? Which protrude through the foramen magnum. And in the flocculonodular lobe, in the middle part of the vermis is the flocculus and part of the cerebellar cortex is nodule. These are two nodule. Here one and this one is the nodule. Now coming to peduncle. There are three peduncle as well. This cerebellum connected to midbrain. Here lies the superior cerebellar peduncle. Where my finger is, this is superior cerebellar peduncle. Here lies. This area where the cerebellum is connected to pons, this area is known as middle cerebellar peduncle. And this cerebellum is connected to the medulla oblongata through the inferior cerebellar peduncle. This one is the inferior cerebellar peduncle. So it is an organ of three, that three lobe, anterior lobe, posterior lobe and flocculonodular lobe. Three fissure, fissura prima, then horizontal fissure and then posterolateral fissure. Okay, not sulcus, posterolateral fissure, because it is deep. Okay, and then there are three peduncles: superior peduncle, middle cerebellar peduncle and inferior cerebellar peduncle. Here you can see in the cerebral cortex there are sulci and gyri. We can see the depression and elevation. Depression are known as sulci and elevation are gyri. In the cerebellum, this depression and elevation are known as fissure and folia. The elevation are known as, here you can appreciate this leaf-like projection, elevation, it is known as folia, and this depression where this stick is, this is known as fissure, and elevation is folia. Just like sulci and gyri in the cerebral cortex. Okay, these are cerebellar cortex and this is cerebral cortex. Sulci and gyri, and here is the fissura and folia. Here the commissural fiber is corpus callosum and here the commissural fiber is vermis. This is inferior vermis and this one is superior vermis. Okay, and here you can see this is the sagittal section of cerebellum. This is the sagittal section of cerebellum. Here we can appreciate this is the white matter and these are the grey matter. White matter is buried within the grey matter and looks like the pattern of tree. This is known as arbor vitae cerebelli. This tree-like pattern is arbor vitae cerebelli. And here you can appreciate this cavity. This is the fourth ventricle. Here, this one is fourth ventricle. The cerebellum forms the roof of the fourth ventricle. Anteriorly or ventrally, there is pons and medulla oblongata, and posteriorly there is cerebellum. So this roof here, this is formed by the superior medullary velum, and here is the inferior medullary velum. Superior medullary velum is formed by the thin layer of grey matter. Okay, so this is the nervous tissue, and inferior medullary velum, this is the ependyma and two-fold of pyometer. So this is non-nervous tissue. This triangular area, this is the fourth ventricle. Okay.